Hi, my name is Caitlin Bridge, ID number 3119312, and this is my AVMA video for Veterinary Nursing Care Fall 2019 semester, section 31421. Now we're going to listen to heart and lungs on a dog. So we're going to start by listening for his heart on his left side, right behind his elbow. And once you find the heart rate, I'm going to set a timer for 15 seconds. So I got 20. You would times that by 4. So this dog's heart rate is 80. He is a little nervous here. Now I'm going to listen on the right side as well. Making sure it's a nice normal rhythm. You don't hear any swishes, which could be a heart murmur. And now we'll go ahead and listen to his lungs. So we're going to start by listening to his trachea first. And then divide their chest into 9 quadrants to listen to the lungs, roughly 2 to 3 breaths for each quadrant. I'm going to make sure you don't hear any crackles or wheezes, which could mean edema, and that you do hear lung sounds and they're not completely dull, which could indicate effusion. I'm going to do the same on the other side. So now we're going to do an ECG on this dog. So we're going to first, he's in right lateral recumbency. We're going to start by attaching our leads. So the white lead we're going to do on his right front. The black on his left front. And red on his left rear. And then we're going to use some alcohol where our leads are.
Yeah, the mice are jumping on the counter and being right in front of us.
So I started the hormone list. All I did was like copy and paste of that and put it in so far.
So what we're looking for, we want a P wave followed by our QRS complex and then a T wave. And ideally they would be evenly spaced apart.
I think so, yes.
And a P wave for every complex. His heart rate is pretty normal. And these all look relatively even spaced. No arrhythmias and no VPCs so far.
That's the story I have. It tastes like mouth poop a little bit.
Okay. Now I'll demonstrate the use of a rabies pole in a dog. So we're going to start with the noose as big as it will go. You want to slip it around the animal's neck and then pull on the end to tighten it down. And now you have control of them and you can lead them wherever you need them to go, at a safe distance. once you get them where you need to go, you just release the end. And then you can safely remove it. Now I'll demonstrate properly cleaning, disinfecting a cage. So first you want to make sure that there's no large debris, all the feces, urine, everything like that is already cleaned out from the cage. And here we use Kennel Care, which is a disinfectant. It does kill parvo as well. It has a 10-minute contact time. So I'm just going to spray down the entire cage, including the top, all the sides, and then the bottom. As well as the door. And now I'll set my timer for 10 minutes. And let it set. So our 10 minutes is up. And we're going to start by cleaning the top first. Making sure to get into all the corners. Followed by the sides. And then the bottom. And lastly, the door. And then Kennel Care does recommend that if you're going to use this on a cage or a surface where the animal is going to be in close contact with, you want to rinse it off. I'm just going to get another cloth, and I just have a bowl of some fresh water here. And we'll just wipe down the sides with some clean water to rinse it off. And that's all. Okay, so now we're going to perform a Schirmer tear test on this dog. So I have our test strips, and I'm just going to bend the very tip where they would go into his eyelid. And I have my timer that's set for a minute. So I'm just going to tuck the bent piece into his lower lid. And start our timer. And if he has good tear production, that blue line should go past 15 in under a minute. So he's already hit 15, but we'll keep it going for the full minute and see where he reaches. So on this dog's right eye, he made it till 19. So this eye would be considered normal. Now we can reset our timer and test the other eye. Anything above 15 is considered normal. Anything lower than 15 could be a sign of KCS. So on this eye, it hit 16, so the tear production's a little lower in his left eye, but still considered normal.
Go.
So now we're going to check the pressures in this dog's eye. We're going to start by numbing it with some tetracaine. So while we wait for that, we'll calibrate our tonal pen. Alright, it's all set.
You ready, Nathan?
Anybody? So I got 26.
Okay, Nathan.
And 24. So the dog I had used for my tonometry demonstration was actually my own dog, and so when I was getting the readings of 24 and 26, I was a little caught off guard with that, so I didn't do a good job explaining. So in a dog, the normal eye pressure should be between 10 and 20 millimeters of mercury, and anything below can indicate uveitis, and anything above can indicate glaucoma. So in a otherwise healthy dog with no symptoms, it was a little concerning to get the numbers of 26, but he had spent the whole day at the hospital and was stressed. So we took it again the next day and they were back within normal limits. But that is something to keep in mind when taking your eye pressures. Stress can cause the pressures to increase, as can the way the holder is restraining the dog. If they're squeezing their neck or their head too tight, that can also increase pressures. So that's something to take in consideration when you're doing those tests. So now we're going to do fluorescein stain in this dog's eye. So I have our bottle of fluorescein stain. And we're just going to place one drop into each eye. If this dog had any scratches or ulcers on his cornea, the scratch would take up the stain and you'd be able to see it. I'm just going to rinse a little bit with just plain artificial tears or saline. And get the excess stain out. And then I have our light source. So for this eye, there is no stain uptake. And none in his right eye either. So now we're going to empty the anal glands on this dog. So I have gloves, I have paper towels, I have some paper towels with Chlorohex to clean after, and our AOA spray. So I'm going to start with some lube and our paper towel. And you just want to insert your finger into their rectum, and their anal glands are situated about 4 and 8 o'clock. And just gentle pressure. And this dog, he's not too full on his first side, but it is normal material. And we'll move to his other side. Same thing, very normal material. You always want to check and make sure that it's not green colored, could indicate an infection or bloody, or that you don't feel anything strange. And then we'll just clean them up. And use a little bit of our AOE spray. So this kitty actually does need an enema, so I have our 12 gauge catheter, 60 cc syringe, and our soapy water. Our catheter is lubed. We're going to start by advancing. Now I'll demonstrate how to apply topical medication to a cat. So I have Feline Advantage here, and in a cat especially, you want to make sure you apply it between the shoulder blades or higher on the neck. That way they cannot lick it. Break the seal. And then especially in a cat like this with long hair, but with any hair, you want to make sure you part the hair so you can see the skin. That way the medication actually goes directly on the skin and just not sit, it doesn't just sit on the hair. If you had an animal with a wound that needed topical medication, you'd want to shave some of the hair first so you can make sure you get it directly on the wound in the skin and it wouldn't get stuck in the hair. And the shaving hair would also allow air to get to the wound, and that would help aid in healing. Now we're going to demonstrate cleaning and medicating ears on a dog. So I have our ear cleaner, some cotton swabs, and then lastly our ear medication. Ideally, we'll pour some cleaner into the ear canal. Some dogs are okay with this and some dogs really hate it, in which case you can saturate a cotton ball and put that in their ear. And then you want to really massage the base of the ear to get up any debris that's in that horizontal canal. And then you can use your cotton to get down in and start to get some of the liquid back out with the debris. Depending on how dirty the dog's ears are, you may have to repeat this a couple times. This dog isn't too bad. You can also use a little cleaner on your Q-tips just to get any of the nooks and crannies. being careful not to go too far in the ear with the cotton swab. Once the ear is adequately cleaned, you just want a dry piece of cotton and try to dry it out the best you can. Alright, and then we'll take our ear medication. And for this dog, he needs 6 drops. So we're going to put it in as far down as the tip will go and do our 6 drops. And then massage that in and try to prevent him from shaking his head for a little bit, just to let the medication go all the way in the ear. And then you repeat this for the other side. Now I'll demonstrate cleaning ears and applying ear medication to a cat. So unlike a dog, most cats are not agreeable to having the ear medication or the ear cleaner dumped directly into their ear. So for cats, I like to saturate a piece of cotton or a cotton ball, and then put that in the ear and massage the base so that fluid goes down into the canal and it helps loosen debris, but it's a little less obtrusive than the liquid going right inside. Wipe it out. You can repeat this a few times if needed, depending on how dirty the ears are. And then put some ear cleaner on cotton balls, or on Q-tips, and get the crevices. Just being careful not to go too deep or be too aggressive with the cotton swab. And then once the ears are clean, you just want to dry them out. And then we'll take our ear medication and just place, for this cat it's 4 drops. And then massage that in and try to keep him from shaking his head for just a little bit. And then if needed, you'd repeat this on the other side as well. So now we're going to administer sub-Q fluids on our dog. So we have a bag of plasma light with our line on it. I'm just going to hang that up. You want to make sure you always use a fresh needle. So for this dog, we're going to use an 18 gauge. And a cat, you could also use a 20 gauge, but you don't want anything smaller than that. And then we're going to tent the skin right above the shoulder blades. This is where the skin is the loosest. And then insert the needle, bubble up, and slowly open our line. And make sure that there's no leakage. And check that it is flowing. And then you can use the numbers on the bag to make sure you know how much you're giving, depending on what the doctor would order. Just keep monitoring, make sure it doesn't stop and get stuck. And then once you reach the amount that the doctor had ordered to give, to administer, want to close the line and hold where the needle is as you pull back, and just put a little bit of pressure. And you're all set. So So now we're going to demonstrate cutting nails on a dog, and you can do that either having them stand or lay down. For this dog, he does better laying down. We've got him on a soft mat, so it's easier when he's laying down, more comfortable for him. And I have my nail trimmers and then some quick stop just in case I nick a nail. And the quick is the pink part. We want to try to avoid the quick and just take the tip of the nail in front of the quick. And then I did just take a little powder and hold it on that spot. And then you'd repeat this for all 4 feet. And now I'm going to demonstrate clipping nails on a cat. So with a cat, you just need to gently press to expose the nail, and then their quick is the pink spot, and you want to go right in front of the quick. And this cat also has extra toes, so we're going to get the tweener. And same thing on the other side. And then you would just repeat this for all 4 paws. So now we're going to place a temporary bandage on this dog for laceration. He doesn't have one, but we're going to use our blue line as our laceration. So we're going to, I have all my supplies out. I'm going to start by drawing up some sterile saline in a large syringe to flush the wound. If he had an actual wound, you would want to use quite a few flushes to ensure all that debris was out of the wound. So I'm going to start with some gloves. And I have some lube I'm going to place over the laceration, and that'll protect it while I'm shaving it. And keep the hair out. And I'm going to shave the hair around the wound, trying to keep as much hair as possible out. And now some Chlorohex can be used to clean the tissue surrounding the wound. use our flush. Having an 18 or 19 gauge needle on our syringe helps with the pressure of the saline coming out to help to debride that laceration. And like I said, you may need to do this, or probably will need to do this multiple times on a real laceration to ensure that all the debris is out. Now I have some sterile 4x4s. I'm going to use these to cover laceration, and then I have some cast padding to apply some pressure as you wrap. And some rolled gauze. It just helps keep it a little tighter. And then some elasticon. And with this, I'll start just a little bit above where the gauze is, and that'll help stick to the dog's leg and help keep it in place. And you want to make sure you are applying some pressure when you put the bandage on, but not too tight. Now that's all set and ready to buy you some time until you can fully debride the wound and suture and close it. Now I'll demonstrate administering a pill to a dog. So we have our pill and our pill gun, our bullseye pill shooter. Some dogs you can pill by hand. Some dogs that are more aggressive or that are more difficult clamping their jaws, this really helps. You can place the pill in the end. And then sort of use this as leverage to pry their jaws open, and then you can push the plunger once it's all the way back. Or you just want to open their jaws and make sure you get it all the way to the back of their throat. And they swallow, and then I just have a syringe of plain water to help ensure that the pill went all the way down and didn't get stuck. Now I'll demonstrate administering oral medication to a cat. So this cat doesn't actually need any pills, so I just have a piece of kibble. And you can either place it directly in the cat's mouth, or if it's a cat that is a little fractious, you can use a pill gun. So with one of these, you would place the pill at the end, and then you could use this to put in the cat's mouth and push the plunger when it's situated on the back of the throat. This cat is very good. So we'll just put the pill and go right into the back of his throat. And then I just have a syringe with some plain water to syringe a little bit and just make sure that the pill actually did go all the way down and didn't get stuck. And that's it. Okay, so now we're going to do a modified Robert Jones bandage on this dog's leg, rear leg. I'm going to start with my stirrups. Tongue depressor just to hold the teeth. start at the bottom, and you want to leave his middle toenails and toe exposed, so you can make sure that it's not too tight with swelling. This layer doesn't need to be too tight. And I have some cling, and this is the layer you want to do relatively tight. Now I'll use our stirrups to pull up and help hold the wrap in place. And then to apply the splint, I have elastic on, put that in place. And if this was for real, we would go a little bit higher and make sure this was well padded at the top. But now to remove it, carefully with bandage scissors, and I'm going to start by removing the top layer of elasticon. Right under the splint. Cotton. And the straps. So we're going to try to take x-rays of his upper incisors. So we're going to select 102 to 202.
I think getting a
Put our plate in.
She wants to look at art yards. We have a
This time we're going to put the plate perpendicular to that tooth.
Okay.
So since that didn't quite come out, we'll just readjust a little bit.
So, dog ate breakfast at 6, and they're going on, she's going, actually the owner of the dog is going to Disney World.
Oh.
Her sister and her sister's husband are here, and they're staying here, and are gonna be staying at her house.
Okay.
They want the dog to spend the night, so they don't have to worry about it tonight.
Okay.
Go home to her tomorrow.
Okay.
And make sure we have that full.
This one is a little bit better. It's showing the roots. So before we start our hand scaling, I'll just quickly go over our hand scaling instrument. So this is a supragingival hand scaler because of the pointed end. It is a bent, it does have a bent shaft, so it's going to work better for cleaning molars and premolars versus the incisors and canines. It has 2 cutting edges, and then it's tip toe at the end. Scale some of the teeth on this dog. I have my gloves, my mask, and my cap on, and our hand scaler. So now we're going to do ultrasonic scaling. And with this, you want to make sure that you're holding it at an angle and not directly perpendicular to the tooth. And get up under the gum line. So now we're going to polish the side, and I have our polishing paste and our propane angle. I'm just going to put some paste on our cup. And ideally you want to use a good amount of paste for each tooth. And always keep it moving. And just repeat for the remaining teeth. Hi, Mrs. Jones. My name is Caitlin, and I'll be going over the aftercare from Jake's Dental today. So with Jake, all we had to do today was a prophylactic cleaning. He didn't need any teeth removed. We just cleaned the tartar from them. So we have our go-home chart here, and he is missing his upper left premolar, P4, from his prior dental after he had fractured it, but otherwise all his other teeth are in good shape. So for him to go home with, we can either send you with a toothbrush kit with some enzymatic toothpaste, and ideally you would brush every day. If brushing is not as easy or he's not as up for it, our toothpaste, since it is enzymatic, just being able to get the toothpaste on his teeth, either with the finger brush or just your finger to rub it on, can really make a difference. The other option we can send home is a Chlorzinc rinse, and you just attach the top and you can squirt it over his teeth, and that'll help kill bacteria. It's not as ideal as the brushing, but it will help if he won't allow you to do any of the brushing. Again, ideally you would do that every day. In 36 hours, that plaque can harden and turn to tartar, and then once it's calcified, there's no getting it off unless we do another cleaning. So if you could do it every day, that is best. The other option we have to send home is a diet called TD, and these are big kibbles, and when they crunch down, it really helps to clean off that tartar the way the food is designed. So you can either use this as their maintenance diet or as treats every day to aid in that tartar removal. And hopefully we don't see him back for another year or two, and we'll do another prophylactic cleaning and keep his teeth in good shape.